woke up with a pounding headache. He reached out for a glass of water and swallowed a tiny pill of Tylenol. Little did he know his body was about to spring into action, turning that tiny pill into relief. As the pill slid down his esophagus, it landed in his stomach. The warm acidic environment began dissolving the outer coating of the tablet, releasing the acetaminophen inside. Soon, the partially dissolved medication moved into his intestine, which is a long winding tube lined with tiny projections called villi. In the intestine, the real work began. But guess what? He didn't give the pill another thought, but his body carried out a complex and efficient process, ensuring the medication worked exactly as it was supposed to. Welcome to Let's Simplify Pharmacology. In our previous video, we explored the basics of pharmacokinetics, breaking down its 4 key phases and explaining each one clearly and concisely. Now, we're going to dive deeper to understand each phase in more detail and how they work within the body. Hello, I am Nurse Franny, a nurse educator at Faba Nursing. Building on the story of Al and the explanation of medication absorption shared in the introduction, in this session, we will focus on the first phase of pharmacokinetics, absorption. I will introduce key terms related to absorption, outline the various routes of medication administration, and specifically discuss the oral route. We will also highlight the factors that affect the absorption pattern of oral medications. Let's get started. In absorption, we focus on the movement of medication from the site of administration, which is the route, into the bloodstream. The route refers to how the drug is introduced into the body. Common routes include oral, sublingual, buccal, rectal, vaginal, inhalation, intradermal, topical, subcutaneous, intramuscular, and intravenous. We will explore each of these in more detail in future videos. Now, let's consider some important concepts related to drug absorption. We'll first consider rate. Rate determines how quickly the drug enters the body. For example, administering IV Zosyn 100 ml per hour means that 100 milliliters of the drug is introduced into the patient's body every hour. The amount is the quantity of drug that moves into the bloodstream. This is often measured as bioavailability, which represents the percentage of a drug that enters the systemic circulation. The onset is the time it takes for the medication to start producing its therapeutic effect from the moment it is administered. For example, Al will be able to feel a relief from his pounding headache within 20 to 30 minutes, as that is the onset of oral Tylenol. The intensity describes the amount of the drug delivered to the body per unit of time and how strong its effects are. Understanding these concepts is essential for assessing how medication work and ensuring safe and effective patient care. With these key concepts in mind, I would like you to know that there are relationships that exist between them. This diagram provides a visual representation of the relationships between all the key terms we just looked at. And also, this diagram provides a visual representation of the pattern of drug absorption. The route of administration influences both the rate and the amount of absorption. The rate of absorption also affects how quickly the medication takes effect, which is the onset. The amount absorbed also determines the intensity of the medication's effect. So, you will understand that these relationships are critical when giving medication to patients, and by understanding these relationships, we can better predict how medication will work in the patient's body. We are now going to focus on the oral route. Oral medications are those that are taken through the mouth. On a physician's order, it is represented as PO, meaning by mouth. This is trying to communicate to the nurse that the medication must be administered via the oral route. And when medications are given orally, they are absorbed as they pass through the epithelial cell lining of the GI or gastrointestinal tract. The pattern of absorption for oral medications can vary due to several factors. And some of these factors include the stability and solubility of the medication, the gastrointestinal pH or the GI pH, and the gastric emptying time. Also, concurrent medications can affect the pattern of absorption for oral medications. The forms of medication can also affect absorption. Please note that these factors also act as barriers to absorption. In our next session, we will dive deeper into each of these factors and explain how they impact the absorption of oral medications. Thank you for joining me in today's episode. We explored the first phase of pharmacokinetics, which is absorption. I introduced key terms related to absorption, outlined the various routes of medication administration, and discussed the oral route. I also highlighted the factors that affect the absorption pattern of oral medications. I want to applaud your courage. Winston Churchill said, "Success is not final, failure is not fatal. It is the courage to continue that counts. You've got this." Don't forget to subscribe, like, share, and comment to share your thoughts and questions. I'll see you in the next video. Thank you and take care.